evening. Sir, okay. Hi. Good evening, and
Recording in progress.
to this. Welcome back to this session of histology slide discussion. This is the 8th week that we are discussing the histology slides. We are done with the slides of general histology and also the histology of the trachea and lung. Let's get started with the slides of the digestive tract today. We will start with the histology of the digestive tract. Later, we will talk about the accessory organs that are related to digestive system. For example, we'll start with the tongue. We'll discuss about the anatomy of the liver, pancreas. Now, all this we will discuss a little bit later. But today, we'll try to understand what is the general plan of arrangement in case of the histology of GIT, and we'll also try to learn about the histology of the proximal part of the gastrointestinal tract, that is the esophagus. Right? With this, let's begin today's slide discussion. This is the slide of esophagus. Again, the first question the examiner would ask you is, how do you say that this is the slide of esophagus? Right? And your answer should be, sir, I can see 4 distinct layers of GIT here. The mucosa, right? Then the submucosa. Then there is muscularis externa. Of course, adventitia is not seen here in this view. So presence of these 4 layers define that this is a slide of GIT, and since the lining epithelium is stratified squamous non-keratinized, this is most likely to be esophagus. This is how you should explain the slide to begin with. Then comes the question, explain the histology or microscopic structure of the esophagus. Done? Right. So let's try and learn how to explain the structure of esophagus in exams. So this is the slide of esophagus, which is the proximal part of the digestive tract. The digestive tract has a characteristic arrangement of layers. From inside out, we have 4 layers. Towards the lumen, we have the mucosa. Then we have the submucosa. Then we have the muscularis externa. And finally, we have the adventitia. This is the same in case of esophagus, stomach, small intestine, large intestine. But based on the features of each of these layers, we can distinguish between which is the layer that we are, or which is the region that we are referring to. So let's get started with the slide of esophagus. So as we said, esophagus is made up of 4 distinct layers. First, let's try and appreciate the layers. So this entire thing that we have here, what is this? This is the layer of mucosa. And what about this layer? This is the layer of the submucosa that we have. So this is submucosa. And what we have here, this is muscularis externa. Of course, adventitia, as I said, is not seen here. Later, we will discuss what is the difference between adventitia and what is the difference between serosa. Let's talk about mucosa. The mucosa itself is made up of further sublayers. Now, what are these sublayers? The first sublayer we have as this lining epithelium. What is this lining epithelium? This is stratified squamous non-keratinized epithelium. Why do we have stratified squamous non-keratinized epithelium? Stratified squamous non-keratinized epithelium protects against the wear and tear produced by the food that passes through the esophagus. Right? So this is the lining epithelium, which is stratified squamous non-keratinized. Then a protective epithelium. Right? Then deep to this lies a thin layer of lamina propria. Okay, so we have the lamina propria. Now, what is lamina propria? Lamina propria is the loose connective tissue lying beneath the mucosa, and this contains the blood cells, lymphatics, and other structures. Are we clear? Right. So this is lamina propria. Then there is a clear demarcation between the mucosa and the submucosa where we have a smooth muscle layer. And what do we refer it to as? We refer it to as the muscularis mucosa. Right? We refer it to as muscularis mucosa. Muscularis mucosa, remember, is a thin layer of smooth muscle which will distinctly separate the mucosa from submucosa. Done? Right. This is regarding the mucosa. Then, when we come to the submucosa is also made up of connective tissue, but the characteristic feature here is it contains submucosal esophageal glands. What is the function of this submucosal esophageal glands? These secrete mucus and these help in easy passage of the hard food material through the esophagus. So basically this provides lubrication. Are we clear? So the mucosa or the lining epithelium is being protected by the thick stratified epithelium as well as these submucosal glands secretions. Are we clear? Right. Now this is regarding esophageal glands. Done. Submucosa. When we come deeper down, we get muscularis externa. Now what do we mean by muscularis externa? Remember, the muscularis externa is again a layer of smooth muscles in rest of the GIT. Whereas in case of esophagus, this differs. So muscularis externa, when we talk, muscularis externa, remember in the upper 1/3 is made up of entirely skeletal muscle. In the middle 1/3, it is made up of skeletal plus smooth muscle. Whereas in the lower 1/3, it is made up of entirely smooth muscle. Done? Are we clear? So this muscularis externa is arranged in the form of the inner circular layer and outer longitudinal layer. Remember, in this section, what we are seeing is only the circular layer and the longitudinal layer is not actually seen. Are we clear? So what is the first thing that we need to remember? First thing, the muscularis externa in case of esophagus is made up of how many types of muscles? Upper 1/3 entirely skeletal, middle 1/3 skeletal plus smooth, lower 1/3 it is entirely smooth muscle. And this is arranged in the form of two layers, inner circular and outer longitudinal. What is the function of this muscularis externa? Remember, muscularis mucosa is also a thin layer of smooth muscles. Now remember, this can help in the movement of the mucosa only. Whereas muscularis externa will bring about contraction of the esophagus, squeezes the food down into the stomach. So muscularis externa is responsible for peristalsis, right? Peristalsis refers to the movement of the small intestine which results in propulsion of food forwards. Is it clear? This is regarding the muscularis externa. Last layer is what we call as the adventitia. Now, what do we mean by the term adventitia? Adventitia is again connective tissue which contains larger blood vessels, nerves, and lymphatics. Right? This is what we refer to as adventitia. How is this different from serosa? Right? Remember, the serosa contains connective tissue, but it is lined by a thin layer of squamous epithelium, which is called as mesothelium. So mesothelium, submesothelial or subserosal connective tissue. This is how serosa is made up of. Whereas the adventitia is entirely connective tissue without any covering epithelium. Serosa is found wherever there is peritoneum. Wherever there is no peritoneum, we will find adventitia. This is the thumb rule. So entire esophagus, except for the terminal portion or the intra-abdominal part, will only contain adventitia. It's only the intra-abdominal part which will contain the serosa. Right? Now, what is the function of the muscularis externa we said? Muscularis externa we said does peristalsis. Right? Now, if peristalsis has to occur, there should be nerve supply. Now, how are nerves innervating these muscles? Remember, the nerves are present in the layers of the GIT by means of two plexus. Within the submucosa, we have something called as the Meissner plexus, also called as the submucosal plexus. Whereas here we have something referred to as the myenteric plexus or the Auerbach plexus. Auerbach plexus controls the muscularis externa and brings about the peristaltic movement. Whereas Meissner plexus is confined to submucosa. Done? So where exactly this myenteric plexus is located? This is located in between the circular layer and the circular layer and the longitudinal layer. Are we clear? So this is how you should explain the slide of esophagus. Now remember, if you get this slide for your histology discussion, how will you go about answering this question? Fine. How do I answer? So go like this. So this is a slide of esophagus. I say this because I can see 4 layers of GIT from inside out arranged as mucosa, submucosa, muscularis externa and adventitia. The lining epithelium seems to be stratified squamous non-keratinized epithelium. Submucosa contains plenty of mucosal glands which are suggestive of esophagus. Esophagus is the proximal part of the gastrointestinal tract. This is made up of 4 layers again. The mucosa is subdivided into lining epithelium, lamina propria, and the muscularis mucosa. Lining epithelium is made up of stratified squamous non-keratinized epithelium. Lamina propria contain loose connective tissue with smaller blood cells, lymphatics. The muscularis mucosa separates the mucosa from the submucosa. It's basically smooth muscle. The submucosa contains esophageal glands which help in lubrication. The muscularis externa is peculiar in esophagus because in the upper 1/3 it is entirely skeletal muscle. In the middle 1/3 of the esophagus, it's a mixture of smooth and skeletal muscle. In the lower 1/3, it's entirely smooth muscle. This is arranged histologically as the circular inner layer and outer longitudinal layer. In between this, we have the myenteric plexus or the Auerbach plexus. Muscularis externa in turn is covered by adventitia. Only the intra-abdominal part of the esophagus will contain the serosa. This is how you should explain the slide of esophagus. Right? There is no need to confuse this. If you ask me, is there any slide with which I might confuse this? My answer is a definite no again. Right? There is no other slide which actually looks like this. Okay? Maybe sometimes this crypt you can confuse with the palatine tonsil or even with the skin and the sweat glands. Right? But remember, this muscularis layer should clearly define and presence of non-keratinized epithelium. So think in which part of the body or which slides do I get non-keratinized epithelium? Esophagus is one, tongue is one. Provided if you have slides of, let's say, vagina or terminal portion of anal canal, none of the other slides should have the lining epithelium or covering epithelium, which is stratified squamous non-keratinized. Are we clear? So this is regarding the slide of esophagus. So when we start our discussion next time, we will focus on the slides of the stomach. We will try to differentiate between the fundic part and the main pyloric part. Then we will compare that with the slide of esophagus. And from there, we will continue our discussion of GI slides. GI slides are very often confusing, especially if you don't get the concepts right. Okay, so next Thursday, we will discuss about the slides of the stomach, especially the fundic part and the pyloric part. Right? Till then, thank you for joining. See you next Tuesday with one more long essay for discussion and next Thursday with these two slide discussions. Thank you.
Recording in progress.